Hello, everybody. Welcome to Para Awareness Week. I'm so happy that you were able to join our webinar to build your own advocacy toolkit. I'm going to give everybody a minute to hopefully click the link that will be shared in the chat, which will just give you an opportunity to bring up the famous one-page summary guide up on your screen. If you don't have one printed out or with you, it'll just give you a moment to follow along. But if you don't have the ability, or if you just want to sit back, relax, and listen, that's totally fine too. We will share all of the printable and downloadable resources after as well, which is going to make you into an appointment assassin, as I like to call it. We will also have a Q&A period, but you are more than welcome to ask questions throughout the chat. PheoPara is part of the chat and will be answering your questions. And as well, I will be happily answering at the end of the presentation. So if there's ever anything that you would like to know, please go ahead and we will have a reserved time for that. So I want to know from those of you who are here and as joining, I want to know in the chat if you know what it's like to attend an appointment. You go to your appointment and you leave in complete frustration, or as I like to call it, crashing out. I think that it's something that we can all relate to. It's something that happens quite often. We are unfortunately tasked with joining too many appointments, too many types of appointments. It's an ongoing thing, whether or not you still currently have disease or if you're in your follow-up stage. It's something that we can't get away from. I want to know who here has been misdiagnosed. Me. And who here knows what it's like to be told you are wrong about your symptoms or something you absolutely know to be true? I'm going to give you guys a second for that one, because that to me is probably the most frustrating and damaging for the mental toll, the emotional toll. Like these appointments take a lot out of us. And I know that a lot of what I share is self-advocacy based, which is it's not lost on me. It's a lot of work, but I'm going to try to make this so that it's so much easier. And when you go to your appointment, you're going to go in knowing that all of these things can happen, but you will know how to deal with them to the best of your abilities with the most confidence. So I want you to kind of sit with this and tell me if this sounds familiar. So your emotions are high, of course. You know, maybe you're getting ready for a surgical appointment. Maybe it's a pre-op. Maybe it's something that, you know, it's really life-changing. Or it could be that you're searching for a diagnosis, or perhaps you're trying to better improve your quality of life, your symptoms. So you're sitting there, you're letting the doctor lead, and they're rushing you. And your knee is shaking. You're getting a little anxious because you know, like, okay, at some point I have to jump in here, but they're rushing and not giving me the space to be able to communicate what I came here for. So you know that you have a list of concerns that need to be addressed, of course. And you take your shot and you're all excited because you're like, okay, I got a question in there. And then immediately you're just like told no. So all of that, and you're just like, okay, wait, I wasn't expecting that. So now you freeze. You can't explain yourself. And those of us here who have Pheos or paras that are secreting, we know, like, you know, something that's going to be a little stressful is definitely going to take a hit to the nervous system. So you can't explain yourself despite the argument that you've prepared and you've maybe, practiced in the mirror 100 times, and you regroup and you're ready to address it again. But by the time you get your stuff together, the doctor is ushering you to the door and bringing you to the secretary and saying to rebook in 6 months. Now you're stunned. You're feeling hopeless because you've done all this preparation and another appointment has slipped through your fingers without any relief. And all you can think of is, I shouldn't have to work this hard to get care. So tell me if that resonates. Because for those of you who don't know me, my name is Miranda. And I have been so stubbornly trying to rewrite the statistics, living with metastatic pheochromocytoma for over a decade. And I have learned both the impact and the importance of self-advocacy 1000% of the time through being let down. I had my first tumor. I had a pheochromocytoma on my right adrenal gland when I was just 19 years old. And so, like many others, I was told the tumor is benign, that I would be fine, that I could move on with my life. But I was still symptomatic after surgery. Despite my begging and pleading, I left every appointment feeling defeated, as if my time had been wasted and my suffering was never heard. And I eventually began to question my own reality, because that's what we do when we're continuously told, no, that's not possible. And we trust in a healthcare professional to know what's right or wrong, or to know what's safe or not. So I started to really doubt myself, and my voice became quieter and I became smaller each appointment, because I just didn't know what to do. And I really couldn't, again, I don't know if anybody else feels this sometimes, but sometimes you're at a place where you cannot take one more dismissal or hear no one more time. And at that time, I just simply had no idea how to advocate for myself. I didn't even know what that meant. And I didn't know you had to. I thought we just show up and trust the doctor. I didn't think of, like, you would not see me printing out my labs or having scan reports, when I'm 21, like going for follow-ups, hello. I was more concerned, about what to wear. Well, that's still the case, but if you know, you know. So my symptoms at that time were, in fact, a recurrence. And I was told that I was now terminally ill, that my disease was metastatic. It had spread to my liver, it had spread all over my organs. And, all I could think was, after receiving this diagnosis and having experienced what I experienced in every single appointment leading up to that moment, I refused to let anybody ever make me feel the way that they made me feel. And I promised myself that I would never doubt myself ever again. So I learned how to review my own data, and I wouldn't blindly trust anyone ever again when it came to my health. And despite my difficult past with this disease, I've learned and realized over time that everything comes down to excellent communication. And we can't control the other person, the healthcare provider, but we can set the tone for what that communication looks like. And we can do our best to try and reframe and control the appointment better. So that's what we're going to be doing today. And before we dive in, to the one-page assassin, I just want to say one thing. I want to acknowledge the fact that self-advocacy is taxing. It is tiring. It can feel unfair. It can feel like I shouldn't have to do this. I'm with you. I get it. It can be really overwhelming. And in the same breath, it can be what saves us time. It can be what finally makes headway or the breakthrough that you've been looking for. And it can honestly be what lifts a huge weight off of your shoulders. Advocating for yourself, hopefully, can be what allows you to take your power back, to take control of your health. So next time you're finding yourself saying, like, but I shouldn't have to, I want you to remember that it's helping you. So next time, and I'll practice this with you, next time you hear yourself saying, I have to advocate for myself, I want you to reframe that and say, I get to advocate for myself. So replace have with get. And that's a very popular mindset trick. It really helps. And I think it just reaffirms the control, like the control that we have in a very uncontrollable circumstance. So again, I'll just remind you, if you didn't print a physical copy of the one-page appointment guide, okay, you can either bring it up on your screen to follow along, or you can just follow along and I'll walk you through. So I'm going to walk you through step by step how to use this, how to customize it to any appointment, how to use it as a tool for yourself. And I really want you to remember, like, this sheet, it's one page. Okay. I'm sorry. I'm trying to put it on my screen and it's not showing, but look at it this way. It's one sheet of paper. So, gone are the days where we go in with like a big binder of all of our past medical histories and, tests and things, because that alone already, you get like the eye roll and like it sets a different tone. So when we go in with just like a clean little duotang, we have one page, right? One page that's ready to go, packed full of information. I promise you it will change the tone of your appointment. So it's saving the provider time, it's saving you time, and you can shift your energy from, like, I don't know if you've ever said this to a provider, but like when you walk in, you're like, I know this is a lot. I know I'm really rare. I know my case is really complicated. Like, we catch ourselves kind of already like defending how much work it's going to be. But instead, you kind of walk in as cool, calm, and collected as you can. You have your one-page summary and you go, I prepared us each a copy of my concerns today. Or, I'm used to being a medically complex patient, so this will simplify things and help us keep on track. So you'll have one copy for you and you'll have a copy for the provider, and I'll explain why afterwards. You can say something like, you'll see I've included my medications, my concerning symptoms, and the most relevant information for today's conversation. Keyword. Because again, it's something we all do. When you have a complex medical history, we feel as though we have to share every single detail of every single thing that's ever happened to us since we're 3 years old. And that's what makes them just sit there and be like, okay, reel it in. And then they get the control of the appointments. That's what we want to avoid. We want to be able to have a collaborative, beautiful flow, this, turn of events where we're like, wow, I'm actually conversing with my doctor. Like, this is going well. That's the vibe I want you guys to have. So I made this one-page guide, okay, in response to the most common complaints that we hear from myself and other patients, which is lack of time, feeling rushed, not knowing where to begin, that's a big one. That's like, for me, that's huge, especially when they just sit down and go, okay, so what brought you in today? Okay, I don't know how to answer that question. And immediately I'm overwhelmed and I have a million things going on in my brain. And that's just not how my brain works. And so I freeze. And then we give too much history. We over explain and we lose time, valuable time. And then potentially we leave with no tests, no new plan, and we're going to avoid that. So the 1-page appointment guide. Let me know, you guys, in the comments, how many of you have it with you, how many of you have the capability of seeing it, so that we can follow along. And whatever you do, just don't forget to download your copy, because it's going to be what helps you so much in the future. So I have named it in the document 1-page appointment guide, and there's one provider copy and there's one patient copy. But obviously I want you guys to edit this document. I want you to change the wording. So number 1, we want to establish the type of appointment you're going to. So right at the very top, where it says 1-page appointment guide, what I would do is put a surgical pre-op or endocrinology update, or whatever type of appointment it is. I'm going to write specifically to what I'm preparing for. And from there, that's going to be your title, and it's going to be the same on the provider copy and the patient copy. First, well, not actually, the first little bit is your date of birth, your height, your weight. So that's just a little trick that I do on all of my documents that I ever share medically, because it skips over the questions they ask in intake, like over and over, that we get kind of like annoyed. You can just give that and it provides everything that they need to know. So before you get to the top 3 concerns, you would also write your medications. So little pro tip, if you have a lot of medications, I would just print off your pharmacy list and just staple it to your 1-page guide. But if you're able to just type them in right there, then it stays all in 1 page. But it's the only exception to the rule with how we can have a 2nd page is for your medication. So we have first top concerns. Okay, so even if you have 7 top concerns, I want you to try as much as possible to narrow it down to 3. And the reason I say this is not because those other 4 are not important, but because top 3 concerns. So think about it like, what are the top 3 things that are impacting my life the most at this moment, and that would need to immediately be addressed? Because if we're realistic, we're not going to get to 7 in this one appointment. So we don't want to skip over the top 3 most concerning. Okay. So when we have that clear top 3 concerns, when you sit down with the provider, it just makes this clear cut. Everybody can stay on track, and we can stay focused, and we can know exactly what we came in for. Moving into key updates. So key updates would look like, for example, I'm going to give maybe 2 examples here. If you're someone who has been actively searching for a diagnosis, a key update would look like discussing your lab results that you did at the last appointment. If you're someone who's in active treatment or doing procedures or already has a diagnosis, well, a key update could look like lab results. Probably would be relevant in every appointment, because typically there are results to go over, whether or not it's imaging or labs. But it also could be how you're feeling. Maybe you had surgery, maybe you changed dosing of your medication. So think of it in that perspective, key updates that you would need to discuss with your provider. And these are different than questions, right? So the next category that I leave space for is the question. So questions you need answered are different than concerns that you have, right? So when we don't differentiate between the two, everything gets jumbled, and we just need to be really, really clear when we're making this page. So it does take a bit of time the first couple times you do it, because you need to but then once you do it once or twice and you realize like, wow, that worked really well, you kind of get a sense of like how it will flow for you. And then the fourth category that I put in the patient copy is what I need from you today. So to me, that's like as clear as it comes, right? Sometimes we can address symptoms, we can address our concerns. We do a lot of like venting and complaining, it feels like, but then we leave with like no actual clear plan, or we don't get what we came in for. And sometimes that's just a matter of lack of communication. Like we expected the provider to maybe think of the things that we, came in for and they don't, and then we leave disappointed. So this just really sets an expectation. It says, this is what I need from you today. And I really want you to not be shy when you fill this in, because the worst possible scenario is you hear no, right? And I know that's not pleasant. I know it's not what we came there for, and I know it can be tough, but if we let fear or shyness or whatever it is stop us from asking for what we need, like I always tell when I'm speaking with a friend or I'm trying to flip it on myself and use self-compassion, the provider's not losing sleep over whether or not you didn't or did get that image or didn't get those labs. Like it's you that's affected, and it's only you. So you're the one losing sleep. You're the one who's not getting help. So that temporary moment of discomfort is worth what we get in return in the long run. The last space, and this is on the provider's copy, not on yours. So the provider notes plan, it says provider notes / plan, and you're gonna leave it empty. So this is a subtle way to show that you expect to leave with a clear plan, not only from what you have provided and what you have asked for, but for their opinion and for their recommendations as well. Because we, sometimes we can go in a little hot. I get that. So this leaves space for that collaborative care conversation that we ultimately want to work towards. And it really says, like, I still would like you to lead the way for my care. As rare disease patients, we do a lot of work. We do a lot more work than what would be considered normal. And having these tiny shifts in how we approach something like a one-page guide to go into an appointment truly can be life-changing and life-saving for a patient who's medically complex and who's rare. I can almost promise, like, I don't have any reason, I have nothing to lose. This is something that I've developed and used over time, just out of my own frustrations, my own learning curves and things that I felt would work better with my providers. And honestly, a lot of like small mental breakdowns because it has been almost 11 years with this disease and it's been very well with metastatic disease. And you can imagine how many appointments that I have attended in that time. And this is the love labor from that. So I really do hope that that you'll see improved outcomes with your provider. But here's where it gets a little spicy. Because if you're still met with no, which I want to be clear, it absolutely can happen because we can have done all the right things and we can have all the best preparations, but you can still be met with no. And it does happen. So here's where on the patient copy at the bottom, this is why there's 2 copies, by the way. One for the provider, one for you. Because yours has these snappy little phrases at the bottom, like a cheat sheet. Because I know that when I'm told no, or if I'm caught off guard, I'm not really able to speak. I mean, it's going to be hard for me to find my words, right? But if I have a cheat sheet right here in front of me, like I can be robotic, I can be dissociated, I can have I don't care. I can just read right off my sheet and make it easy. So for example, no. So I've just been told no. I'm going to say, let's make note of that in my chart. So at least if it worsens, we'll have it on record. Okay, so that's one way of approaching something, depending on the situation. If it's a matter of like, I just don't feel heard and I feel like, no, like we need to actually revisit and re-talk about this. You can say, I've had a lot to self-manage already and I really need more support. This is a big one because this is something that we feel, I know I feel really almost like ashamed to admit at times, like that it's just no, like it's too much in my court. I need help. Like I need your help now. Even if I'm an expert advocate, I need your help now. And this is really, really important to say. You could also say, I'd like to revisit my top concern. You could say, I don't feel my symptoms are being fully addressed. Can we explore other options? So I just put some examples on your copies on the downloadable one-page appointment guide. But I am also going to share with you guys afterwards. I'll coordinate this with PheoPara, but I was thinking about it and I have quite a few examples of how you can rephrase and how you can kind of pivot and put different, because I think that it depends on the appointment as well. If I don't feel heard phrases might vary between the type of provider and the type of appointment you're going to. So, you know, you could say, could you please help me understand so-and-so? So that just like opens up a conversation without having to necessarily like be combative or disagreeing with something they've said. It just like revisits a topic. You can say, I've been tracking this for weeks and it's only been getting worse. Or this symptom is interfering with my daily life and my ability to work. You could be more direct and you could say, I'm concerned about pheochromocytoma and I would like to rule it out. Point blank, period. And then there's more hard-hitting phrases that I have used. For example, if you were in my shoes with these symptoms, what test would you want? Or I've tried blank and blank for this amount of time and I've seen no change. So you can see like there's a common thread and just small changes in what we say when we're told no. You could be a little more direct in saying, could you help me better understand what you think it could be then? You could also say something like, if you can't order this particular test or scan, who can? Can you send me to that person? And most importantly, okay, after all of this, so all of these, I just wanted to say all of these phrases, I'm going to make sure are sent out to you in one way or the other, or I will put them on my blog. PheoPara will put them out, but we will get you the list of these phrases because I only included about 5 test phrases on your sheet, which you can edit and add your own to whatever sounds good for you, like whatever flows off your tongue. Make sure you test it. You kind of practice saying them, because if it sounds funny the way it's written for you, then you probably won't say it. So just make sure you're comfortable with how it sounds. And after everything is said and done, if it still goes south and you still didn't quite get what you needed out of the appointment, or perhaps you still froze, no shame there. I just want to remind you that you can always take time to reflect on the appointment, and you can follow up and you can address it in like a part 2. And the reason I really, really emphasize this is because there's multiple situations where it could just not have gone well, but it also could be that the doctor provided new information that you weren't expecting and you weren't prepared for like the option C. So you had A and B locked and loaded, but C came in and you were like, oh, now I'm all messed up and I'm not prepared. So I just want to remind you that we always have the ability to pause, take a second, and if it doesn't feel right in that moment, we can take some time to reflect, maybe 24, 48 hours. You know, go to the support group, talk to the friends, talk to your family, and then you can come back with a follow-up email or maybe an appointment, like a request for an urgent appointment to follow up with the information. And last, use all the resources that are available to you. So if your doctor has a nurse or someone in the department that you can, let's say, I don't know, like a pivot nurse can sometimes order a test for you in between appointments, or, you know, you can sometimes you can get things done differently with a few emails. Sometimes we're shy and we think like, oh, I don't want to bother anybody, but no, we have to bother people. It's part of having this disease. And it truly, and I'm speaking from like I'm talking like lived experience as of yesterday, okay? Not like, oh, years ago I used to be nervous. Like, no, I still get nervous. I still get nervous. I get very uncomfortable, and I appear a certain way. I appear, you know, this is all part of my tactic to be able to show up and feel confident and feel like myself and not be, you know, overshadowed or overburdened with this disease. So I feel annoying at times. I feel like, no, I simply cannot bother one more doctor. No, I will not. And I always have to remind myself of my own words. Like, you're not there to make friends. Okay. Even if you really like your doctor, they're not your friend. So you're not there to impress them. And it doesn't matter how repetitive you are or you sound. It doesn't matter. You deserve care and you deserve relief. So I want you to like kind of just like pause, sit with that, say it to yourself. I deserve care and I deserve relief. And every appointment that you go into, I want you to remind yourself of that, because it's really easy to forget. And it's really, really easy to sometimes say, like, oh, it's not that big of a deal, because we just don't want to be, we don't want to be a burden to anybody, and we're tired. And I get that. And I just really, really want to reinforce that, because that's me. It's me right now. It's me at times. And this couldn't have come at a better time, because I really, truly am speaking from my heart. I'm speaking from a place of, I have incurable disease. So that means I'm going to continuously be faced with these conversations and these issues over and over and over again. And so it's important to really ground yourself at times and just to remind yourself why you're there. Yeah. You know, like, even if it feels like it's become your job, or, it's become your identity, like, it's like you deserve care and you deserve relief, period. And whatever that looks like for you, that's what we do to get there. So I truly hope that this 1-page appointment guide made you feel a little closer to being an appointment assassin. And I hope that I will hear from you your next appointment. Say, that went so much better. And this webinar will be available to you to rewatch if ever you need a reminder, if ever you need just like some hype to get you ready. And if you guys have questions now, I would be so happy to answer anything that you have. I haven't been looking at the chat. I have been in my zone. So, oh, I love that you guys are repeating, I deserve care, I deserve relief. The freeze is real. A lot of you are relating to having froze several, I'm sure. Yeah. What do I do? What do I do if I still block even with the 1 page? So if you still, like I had mentioned earlier, if you still block with the 1 page, I want to remind you that there are just circumstances. So there's 2 circumstances here that I commonly come across. You could run into a situation where you've done everything right, but you just simply froze. Like, you weren't able to communicate. And I think that it's really important to just remind yourself that there's no shame in that. We have a lot on our shoulders, and it does happen. So you don't want to leave like feeling this big guilt, like, oh, it's my fault, and beat yourself up. Like, that's the first thing, because there's always follow-ups. There's always ways of, potentially emailing the nurse or the doctor directly. And we could always make follow-ups to revisit. Maybe at that point, you take a trusted friend with you, or someone who can speak on your behalf. Or perhaps you write a letter to the doctor because you're not able to communicate. And that's okay. That's also okay. And then there's situations where there's just providers that are unwilling to like entertain anything you're saying. And it's just like, you're just met with like a 3-minute in and out appointment where you don't even know what happened. Like, you have to give yourself grace for situations like that are completely out of your control. And so, yeah, I would say if any of these things happen, you either revisit or you bring it to, let's say it went really badly with your oncologist. Well, maybe you bring it to your endocrinologist. Or if it doesn't go well with your endocrinologist, you can potentially bring it to your family physician. So ultimately bringing it to another provider that you would feel maybe would better listen to you or could potentially help what you're trying to achieve. Should you continue to pursue what you want when you feel ignored, or that the doctor isn't aligned to treating you in your situation? I think that that's something that you would likely feel in the moment, but also like there's a lot of context and nuance that would be considered here, because sometimes we don't have the ability to go to another doctor. So if it's really like, okay, I'm not going to have the opportunity to see another doctor in this case, and it's something very urgent, I would say definitely try, like, even if the doctor isn't aligned with you, even if you're feeling like butting heads, I would say you're there. You already took the time to go. So take as much as you can from that appointment. And of course, if it's just not working, like if the energy is not working and it's doing more harm to you than good, then there will come a time where you would have to change providers. Sometimes, and again, I just want to be clear, I don't say that lightly because I know how difficult it is to change a provider. So very aware. Sometimes it takes going to the doctor, like the wrong doctor, the doctor that doesn't have anything to do with that particular concern, but it's a really nice doctor and they're really willing to listen to you. Maybe it's going to that doctor and having them help you, like guide you to the next person that can potentially help. So yeah, I think that it is worth trying to pursue it, but with caution. What do you do when your doctor is a surgeon or a cardiologist and it's an endocrinologist that you need? So depending on where you live, I would think that this would change, but something I see pretty common here in Canada anyways, where we get set up with not the wrong doctor, but let's say you need an endocrinologist because that's who's supposed to be leading your care. And of course, the care approach will be very different if they are the head of your care, but you only have a surgeon that took out your tumor and happens to be doing your follow-ups. So what I would say in that case is I would actually use the one-page appointment guide, and I would go see the doctor. Like, let's say it's the surgeon. So I would go see the surgeon and I would let them know, like, okay, my top concerns are this, my key updates, but I would frame it towards getting an endocrinologist. So being referred to an endocrinologist so that you can address proper imaging, proper labs, you can have a more complete multidisciplinary team, which is what we need. And of course, if there's again, depending on where we live, there could be a different way of having referrals and getting referrals. But I would say, like, if you ever have pushback with one doctor, it would be important to, go to a neutral doctor like your family physician and just explain the situation and have the referral sent out that way. But ultimately, I would say always push for, if you know that that's the right doctor that you need. If everyone else has that doctor and you don't, then I would say by any means necessary, try and pursue what you know to be true. Do we have any other questions? And if not, or just while we're waiting, I will say that throughout Awareness Week, it's a lot of work. I thank PheoPara Alliance for all the work that they do. And I'm so happy to have been able to do this because actually last year, well, I was interrupted, like rudely interrupted by a little bit of thyroid cancer. And I wasn't able to do my yearly webinar and I was very upset. Okay, so 2 questions that we have. How do you address misinformation during an appointment? That is such a good question. Such a good question. So it's one of those, again, it's very situational. So if this is a provider that I trust, that I get along with, and that I feel comfortable speaking with. And I feel confident enough to say, so, okay, we're going to use a very specific example that tends to come up. So your provider, you have a pheo or a para, and your provider uses the word benign. Still, in 2025. So you're sitting there and you're like, oh my God, how can this person be so outdated? But I love this provider and I really want to just correct them, and maybe they can, brush up on their pheochromocytoma, paraganglioma skills. I would absolutely, if it were me, I would say, just while I'm here, did you know, like, you can either say it like oh my God, did you know, like, latest news, and let them know that the terminology has been changed and updated. So we're no longer using the word benign. We're now using metastatic or non-metastatic to make it less confusing for providers, patients, and have the best ongoing care. I really would, I would just address it. I would, depending on the doctor, I would really just say, like, no, we don't say benign anymore. And I would say where my source is. I would just straight up say the World Health Organization as of 2017 stopped saying benign, and just leave it at that. And I'm the type of person where I would follow up with an email providing the source of what I was saying in the appointment, to say, like, okay, I really didn't just make that up. But if it's a doctor that I'm very uncomfortable with, or a doctor that doesn't, where the tone is not perfect and you're just feeling a little bit like walking on eggshells, depending on my energy level and how I feel it will affect me and other patients, I may not say anything. Like, I just might be like, okay, today is not the day for this. But I have a hard time staying quiet in these situations. So I feel like it's a pick your battle. So you can either say it. If I'm going to say it, though, I feel like I'm going to say it with my whole chest. I'm going to say it like, if I'm going to address it, I'm going to be ready to fully address it. And if you're not, just like, I would say, let it pass. And if it really bothered you, let them know in an email, send them the link, and set the record straight. Because if we don't, more than likely, they'll just be happy that you let them know, and they'll just take the information and they'll update it. I've done it plenty of times and they were appreciative. And then I could even see in the future correspondence that they would use the correct terminology. And I was like, oh, so happy to see that. So another question that we have is, have I ever changed providers? So, no, like, let me think. Have I ever changed providers? I don't think I've ever changed a provider of, like, a main provider. So, like, I've never changed my my main team. My core team people. I've even run into situations where I have had situations where I didn't feel like, I felt like we were almost at that point where I would have to change providers. But I feel that's why I said at the beginning, like, communication, I feel, is first and foremost, and it's so important, because most things can be resolved with the correct communication. But sometimes it's being able to know how to do that, and also being, I think, like, I have to ask myself at times, like, am I regulated enough to be able to have this conversation? Because you can get very emotional. Like, it's very hard to do all of this. So for the most part, as far as I can remember, I have been able to work out the differences with my doctors with communication. And I haven't had to do anything dramatic in changing the provider. But I say, like, if you do have to change providers, like, obviously you didn't take it lightly. You didn't get to that point because you didn't think about it and because it wasn't working. So if you do ever have to, like, I would just continuously remind yourself that you deserve care and you deserve relief. And if it takes changing providers to do that, then that's your right. And you deserve to be able to do whatever you need to feel your best and to feel safe when in an appointment, because it's your health at the end of the day. So I don't see any more questions, and I think that it's almost past everybody's bedtime. So I'm just going to thank you. Thank you so much. I really enjoyed this. I've loved chatting with you guys. I love connecting with you guys during PheoPara Awareness Week and every other time. And always feel free to reach out, ask me questions, send me a message. I'm always happy to answer, and I'm always happy to chat. And of course, PheoPara Alliance is always there for you guys and for us, for all of us. So thank you. And remember that Patient Education Day is approaching September. Check out the PheoPara Alliance website for all the upcoming events. Okay, I'm gonna get distracted. So bye everybody. Thank you so much.